Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. The patient position is supine like so, with approximately 30 degrees of knee flexion. Now, everything is still the same if we want to scan the distal quadriceps tendon or the quadriceps tendon insertion at the proximal pole of the patella. However, in this case, we generally slide or move a little more distal and sweep through both lateral and medial until we see the entire thickness or width of the quadriceps tendon. So that's how we scan for the quadriceps tendon. Now for the patellar tendon, everything's the same. We simply come up and around and beyond the patella until we're looking at the inferior pole of the patella. And with some ultrasound probes, with some patients, this interval between the distal patella and the proximal tibia, you may actually see the entire distance all on the ultrasound screen at once. Now the area of interest is going to be immediately subcutaneous, and that's going to be your patellar tendon, and the movements are we sweep lateral and medial through the entire patellar tendon. Of course, we also see the Hoffa's fat pad. It's the large area in the center of the screen. I'm going to show you how to scan and inject the quadriceps tendon and the patellar tendon. Similar to a knee joint scan, our landmark is going to be the patella, and then we drop on with the orientation of the probe long on the femur, and the area of interest is highlighted by the yellow arrow. If I saw tendinopathy or tearing here, I would turn the probe in short axis on the tendon, and I would place the needle deep to the tendon here with cortisone, or with PRP, I would go directly into the tendon. The yellow arrow is now inside the tendon for PRP. Now the arrow is deep to the tendon for cortisone. I'll continue on with the demonstration for patellar tendon. I'll now slide distally and get the patella on the left-hand side of the screen. We now see the entirety of the patella tendon between the patella on the left and the tibia on the right. If we were to see tendinopathy or tearing here, I would rotate the probe 90 degrees, and for cortisone, I would place the needle like so, down to the yellow arrow tip, and for PRP, I would place the needle inside the tendon, right where that yellow arrow is pointed now. For distal patellar tendon pain, I would simply slide distally, and I would do the same thing. For PRP, I would go in the tendon like this, and for cortisone, I would go deep to the tendon like this. And that's how I would scan and inject the quadriceps tendon, the proximal patellar tendon, and the distal patellar tendon.